The Pediatric Infectious Diseases Fellowship Program at the University of Louisville and Norton Children's is unique in that it really allows our learners to individualize their pathway through fellowship to better meet their needs for their future career goals.
Our passion is to train fellows in our own image. And what I mean by that is that all of us have contributed to the field in some way. And in some cases, in ways that have reached across the country and even internationally.
We are a small program. We train one fellow every 3 years. And because we're small, we can give each fellow really personalized attention. We also function a lot like an apprenticeship. So our fellows act like junior attendings from the beginning.
We really try to integrate the clinical medicine and the research training throughout all 3 years. And so I get a little bit of clinical all 3 years. I get a little bit of research time all 3 years. So I feel like I have a very well-rounded education all around here.
Our fellows will have the opportunity to explore different niches within infectious diseases like antimicrobial stewardship, immunocompromised host and transplant infectious diseases, vaccine clinical research, infection prevention, and public health, all while working alongside faculty who are known for their clinical teaching and who are well recognized both regionally and nationally within their fields.
Our division publishes a lot, and our fellows really get an opportunity to jump on that. We have really the world's experts in vaccine publications. There's a ton of clinical research that we could publish on.
Everybody has their different niche here. And so I have been able to get a taste of a little bit of everything. And so I've been able to explore all of those different career opportunities just by knowing the different attendings.
We are a big family here, and there's a lot of collaboration and a sense of being a part of a team. And they have a wealth of knowledge. They have their own areas of interest and expertise that really adds to the team.
And so it's really nice to be able to tell families, hey, you're getting all of these doctors' brains for just one, and we all talk about you and we all think about you. And I think it's the same when we could do our research projects, when we just sit in the office and talk about what are the next things we're going to think about, how are we going to help the residency program, what do we want to do better. I think it's a very collaborative approach, which I appreciate.
We do a few different set up MDC clinics, which is our multidisciplinary clinics, and those are officially recognized by Norton's, where our ID attendings work collaboratively with other specialties and see patients at the same time. So one of those is we have our Miss C, and we work with cardiology and rheumatology, infectious disease. We see the patients in one appointment, and all of those attendings are there. We also do transplant clinics, so we work with kidney transplant, dietitians, social workers, and we see those patients in an actual clinic. Same thing with heart transplant clinics, we do that. So they will cross coverage and rely on each other's specialties with just a phone call or walking up and down the building. That's the one perk of the NOVAC, is that all of those specialties are in the same building. So if we have a question for cardiology, we can walk up a few floors and just ask that question to any of the attendings that are there.
We also have a separate transplant and immunocompromised host infectious diseases service where our fellows will have the opportunity to both lead and participate in multidisciplinary rounds with our intensivists, transplant cardiologists and nephrologists, and pharmacists.
The fellows are part of the family, and we get to know them so well that we're able over the first year or two to guide them into where we think they have their strengths and where they can be successful. We don't force any square pegs into round holes.
There is wonderful mentorship that I get here. All of the attending faculty are very supportive of my career goals, and I knew that that would be the case.
We have people who are involved at the highest levels in their field. Whatever interests our incoming fellows gets to be explored and fostered with the help of people who have been doing this for many, many years and really have very few equals in terms of their ability to get things done.
We have an ambulatory practice in a state-of-the-art facility. We see patients who need follow-up after hospitalization, but we also have referrals from all over the region. And that ensures that the fellow can see common infectious diseases as well as rare and unusual infections.
We offer a vaccine clinic for a lot of our patients, and so this just helps so people who may not have access to vaccines or the right insurance potentially to be covered in some clinics, for all kids to come in to be covered, to get their vaccine, so it's kind of a one-stop shop place for people. So they're able to get everything done all at once, and the providers are able to make sure that they get everything that they need.
There's always something to do here in Louisville. There are parks and nature preserves to go and explore.
People are friendly. You can get across town in 25 minutes. The cost of living is pretty reasonable. Fellows who want to purchase their own home can do so.
I love the food, and I think most people will tell you that because there are so many options. My family and I, we love to just try new restaurants.
Louisville is a great city. I think it has a very unique history and culture. I think Louisville has something to offer everyone.
It's a good-sized city, I feel like. It's not too big, it's not too small. I feel like you can never be bored in Louisville.
I see our program continuing its tradition of producing outstanding clinicians, educators, and scientists who will make major contributions to the world of infectious diseases through clinical service, teaching, and scholarship.